The latest news, updates, and more from the world of health and medicine. This is Medical Minutes, brought to you by Community Health Network.
TV medical expert Dr. Janelle Gordon is here. Good morning.
Good morning, Scott.
Autism very much in the news today. In fact, it can spark heated debates even among families, between families that are dealing with it. Define for us what that medical professionals now currently consider autism and how it fits into everything.
Yes, so autism spectrum disorder is a neurobehavioral disorder that includes restricted interests, repetitive behaviors, and significant challenges that can occur with social communication.
There has been, and this is not in dispute, a rise in the number of diagnosed autism cases. Do we know definitively what's behind that?
Yes, so what we've seen is that we're getting numbers now that about 1 in 31 Americans have autism spectrum disorder, and that's about 3 times higher than it was in the early 2000s. We do know that we have broader categories for diagnosis, and that's likely leading to better screening and diagnosis as well as awareness in the community.
People want to know if behavioral or environmental factors come into this, and if you really want a conversation to get started and heated in some cases, link autism to vaccines. What's the current scientific understanding about any links between vaccines and autism?
Yes, so we do know that there is possible environmental exposure that can cause what we call epigenetics. So there's likely underlying genetic mutations, and then on top of that, possible toxins, medications, pollution in the environment that could increase someone's risk of having it. What we do know is that back in the late 1990s, there was a study looking at 8 individuals who got the MMR, measles, mumps, and rubella vaccine, and later developed autism. And from that, it skyrocketed, everyone thinking that there was a definitive link. However, multiple studies since then, large-scale case-control studies, have shown that there is no association. Then individuals were worried about the preservatives that are in vaccines, not MMR, but other vaccines. That also has been disproven. We've also looked at the number of vaccines that we give a child and its association with developing autism, also been disproven. What we do know is that from twin studies, there's likely a 60 to 90% hereditary likelihood to cause autism spectrum disorder. And then environmental toxins, which we need more research on, likely increase the risk further.
So if any of this raises a red flag for parents, what should they do if they're concerned my child may be symptomatic of autism?
Yes, so I do want individuals to know that even though there can be significant challenges with this disorder, 1/3 of individuals with autism lead very capable lives with minimal to no assistance. That is if there's early intervention. So it can be very frustrating and challenging. If you even have concerns still based off of what we've said here today regarding vaccines or anything, please get your child seen by their doctor. If they don't have a doctor, look at your local health department, call there. Don't be afraid to get a second opinion. If you feel like someone's telling you no, your child is fine, and you just feel like I have a hunch that something is not right, seek further evaluation and care. And we typically do screen at a well-child visit around ages 18 to 24 months of age.
There's so many times now that I'll go to a doctor and I'll go, well, I think it's this, and the doctor will be patient with me and say, I'm glad you looked at Google, but I've actually studied my entire life to talk about this. Is this one of those that you have people showing up and says, well, I learned on Facebook this, and you may be concerned, yeah, but you didn't learn the truth?
I encourage my patients, especially parents, to do your own investigations. I encourage them to be in support groups. Thank God for technology, we have these online groups that you can be in. However, there is a lot of misinformation out there. So I say bring the information to me, take it to your doctor, and let's dissect it together. And we may not have the answer because research is always ongoing, although we know there have been funding cuts and some people are worried that that could decrease the amount of studies that we're able to do. But I just say stay hopeful.
And you say autism research funding is absolutely necessary in some form or fashion.
It is. What we do know is experts are saying we likely don't need more studies looking into vaccines because multiple studies have been done over the past decades. However, we do need more information on environmental exposure as well as why some populations are at increased risk more than others. So we do know that Asians, blacks, and Hispanics have a higher prevalence, and we're not quite sure why.
Waiting room is full with other folks waiting for their morning checkup, but that was ours this morning with Dr. Janelle Gordon, Wish TV's medical expert.
Thank you, Scott.
Absolutely.
Have a good day.
You do the same.
This is Medical Minutes, brought to you by Community Health Network.
Learn more and get more with Wish TV.
Online at wishtv.com, and when you follow Wish TV on Facebook, be sure to check out more great podcasts from the All Indiana Podcast Network now.
Now at allindianapodcastnetwork.com.